Does your dog or cat have a fatty lump, also known as lipoma? Well, my dog Tula has one as well. I'm going to be showing you my top 5 studied remedies that potentially could really help shrink that lipoma without surgery.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Lipomas, they're these benign fatty growths, and in some dogs they can be really common. But not only dogs, it occurs on cats. It occurs on people. Some people have multiple lipomas, even birds like budgies. Pretty common to occur on the chest wall. And Tula here on her chest wall, there's this little lump that's popping out. It's been checked. It's just fat cells. It's the benign fatty tumor, the lipoma. While I was initially in practice, I used to tell clients it's a fatty tumor. It's something we can monitor. But if you want to get rid of it, you're going to need to have surgery. Turns out, conventional Dr. Andrew wasn't always right, and there are alternative options. Plus, I encourage you to stick around to the end because there's a new remedy. I've seen it work on a few different people. It could really help your dog. Number 1, it's an amino acid called L-Carnitine. One study in particular looked at budgies, which apparently are really prone to these benign fatty tumors, these lipomas, and they found that L-Carnitine, it was the most effective at decreasing body weight, shrinking these lipomas. It's amino acid, it plays a key role in metabolism, in particular muscle mass, and it's been well used in people. It's also been well used in our dogs. More often though, we're using it for something like a type of heart disease. But it's safe, it's well tolerated, and there's research showing it specifically targets fat metabolism. Then by doing that, it's breaking down those fat cells, the lipoma shrinks. We're looking at a standard dog dose of 50 mg per kilo twice a day. So we have 22-pound Tula, she's 10 kilos, 50 times 10. That's 500 milligrams per 20 pounds of body weight twice daily. These are 500 milligram capsules. You'd be getting 1 capsule twice a day. Number 2, the magic of green tea extract. There are a number of studies specifically looking at green tea extract, how it can increase metabolic rate, and specifically targeting the fat cells. One study looked at how green tea extract causes fat oxidation, increasing metabolism, one at rest, and secondly, even more so with exercise. I probably first talked about green tea years ago, in particular focusing on our dogs that had lipomas. And what we're finding is if you can take the concentrated part of the green tea extract, you're going to get a better result. This is the green tea extract pills. Each pill is 400 milligram, a little capsule. Pretty typical dog dose. We're looking at 50 milligrams per 10 pounds of body weight daily. Tula will get a quarter of this capsule. As she's 20 pounds once a day, I just cut it open, sprinkle that amount onto her food, and I think with a bit of canned food, you probably eat it. The green tea extract, and we've seen it being really helpful for many dogs. Good thing to consider. Right, Poodle? Number 3, this is the wonderful supplement coming from the mother's first milk, colostrum. Colostrum, it's that really important initial antibody that essentially helps protect all the newborns before they have a well-functioning and developed immune system. But what we've seen is there are a bunch of different nutrients within colostrum. It's been well used in our dogs and cats. We're seeing it be really beneficial to help support the immune system, to help coat the intestinal tract, to help speed intestinal healing, help prevent secondary side effects of the NSAIDs. So it's got a bunch of big uses. But one in particular they've seen is it can also increase metabolic rate. In fact, many athletes, they're using colostrum for just that. They're increasing metabolic rate, they're actually increasing muscle mass. So you put on more muscle, essentially you're dealing with less fat. Less fat, we're shrinking the lipomas. Standard dog and cat dose of the colostrum, 100 milligrams per 10 pounds of body weight daily. These are 500 milligram capsules. Little Tula, she'd be getting a half a capsule once a day. These are 500 milligram capsules. Tula will be getting a half a capsule once a day. Perhaps you've tried a couple of the other remedies. You've got a dog with lipomas, nothing has worked. I encourage you to think about trying colostrum because it's one where it's super darn safe. It's been used on thousands and thousands of dogs. Really effective for lots of different conditions. Give it a try. It's safe, potentially helpful. Number 4, increasing metabolic rate by adding in a specific type of fat. This is MCT oil, comes from coconut oil. MCT oil, it stands for medium chain triglycerides. It's isolated from coconut oil. What's really interesting about MCT oil is it can become a preferred energy source as opposed to the body using things like glucose or blood sugar. So when that happens, we can see some positive benefits in our animals, specifically our dogs. We can see dogs that seizure, they actually seizure less because they're not absorbing using glucose as a source of energy. When a person or a dog consumes MCT oil, it's converted into ketones. When ketones are used as a source of energy, then we see our dogs that they seizure less. We can also see marked increases in metabolic rate. We can see increased muscle mass. We can see fat loss. Hence the whole keto diet and the whole craze around what you eat and don't eat, etc., etc., etc. But take away popular culture, everything else, there are some real big benefits of considering adding in MCT oil to your dog's diet, especially a dog that has lipomas. And in fact, there's a new specific dog diet for seizures. The primary component of that diet, ta-da, you got it, MCT oil. But you do want to start slow. I would suggest a starting dose of a half a teaspoon per 20 pounds of body weight daily. Work your way up to 1 teaspoon per 20 pounds of body weight daily. Tula, she's had before and she kind of what do you think? She kind of liked it. You like MCT oil? There. So if I'm going to specifically target her lipoma, this would be one of the things I think I'd add in. But as I said, start small, half a teaspoon per 20 pounds of body weight daily. Work your way up to double that dose. You're going to need to give it for about 4 weeks before you can give it a reasonable assessment. And as you can see, she's going to consume it. It's good for you. Just don't get diarrhea. I don't want that. Number 5. This is a new topical remedy. It includes the anti-inflammatory rapidly penetrating the skin, DMSO, along with everybody's favorite anti-inflammatory from the plant, aloe vera. So interestingly, lipomas, they're a big problem for a whole bunch of people. So because of that, many people try a whole bunch of different alternate remedies. So one of the few ones, especially topically, that seems to have helped some people is the liquid DMSO. And what they're doing, or what we're seeing, is you apply it topically, it penetrates into the skin really rapidly. That's one of its big benefits. It's going to concentrate within that fatty growth, that lipoma, and then it's going to cause a bit of an inflammatory reaction. It's going to bring in immune cells. They're going to target that lipoma and start to shrink it up. Because you need to almost wake the immune system up sometimes so it can recognize, that's not normal, let's attack it. A few specific case reports involved using topical DMSO, about 70% of this, along with topical aloe vera. I think what's happening, if you got the DMSO penetrating into the skin, getting into the lipoma, then also it's bringing the aloe vera as well. And for whatever reason in combination, that's triggering this immune response to attack the lipoma. Plus, it's kind of a nicer mix, right? Aloe vera got a bit of a soothing quality to it, along with the DMSO getting into that lipoma. Tula's got this little lipoma here on her chest. Got my fingers between it. What I'm going to do is I'm going to put in 3 or 4 drops of the DMSO. Let's do it right here. On top of that. And I'm going to put a little squirt of the aloe vera. Here we go. And just rub that in with my finger. If you don't want to absorb any of that DMSO, you may be better off than obviously use gloves. I don't mind because I'm getting up to the age where I'm starting to feel some creaks, and I'm happy to get some anti-inflammatory things going on. So I'm just going to rub that in twice a day. I'm actually going to do this with Tula. I want to try this new topical treatment, see if it'll do anything to shrink that lipoma. That's it, little poodle. There's all our new 5 remedies. I'm hoping one of those is going to work for your dog and one's going to work for her. Thanks so much for watching this edition of Veterinary Secrets of my top 5 new remedies for lipomas and dogs. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.